welcome. You're watching this because you're about to start your pelvic floor exercises with your pelvic health physiotherapist prior to your radical prostatectomy for prostate cancer. My name's Louise Hug and I see a large number of men for their pelvic floor exercises prior to their prostatectomy as a form of prehab to prepare for the changes that are going to occur during surgery and to ensure adequate strength ready for recovery and an understanding of correct pelvic floor exercises ready to strengthen the muscles back up that are involved in the surgery to manage bladder control issues after prostatectomy. During a radical prostatectomy, the entire prostate is removed in order to remove the cancer as well as any prostate cells that have a propensity for becoming cancerous. So using either an open surgical method, a laparoscopic surgery, or robotic laparoscopic surgery, your surgeon is going to remove this prostate, which sits below the bladder. It wraps around the urethra, which is the pipe that goes down and out through the bladder to eliminate fluid from the body. And they're going to make an incision below the prostate to detach the apex of the prostate and the urethra from the prostate bed. What we are mostly concerned with as pelvic health physiotherapists is the pelvic floor musculature. We have a urethral sphincter that is quite local and wraps around that urethra below the prostate. And then we have pelvic floor muscles that interdigitate in with the external urethral sphincter. And they have a broader, wider connection and attachment around the inside bowl of the pelvis. These muscles are important, both the external urethral sphincter and the pelvic floor muscles, for your bladder control. They both contract and compress around the urethra for urinary continence, the ability to hold onto the bladder without any leaks. The urethral sphincter works by squeezing around the urethra and narrowing it, and the pelvic floor gives added compression around the urethral sphincter. The changes in the surgery include the prostate being removed from that space, the bladder being drawn down into that space, and a reconnection made from the base of the bladder down to the top of the external urethral sphincter. And a connection is made there as the surgeon uses stitches to create an anastomosis and a reconnection of the urethral pipe. That requires a healing phase. The muscle is preserved during the prostatectomy to the best ability of the surgeon, depending on where the prostate cancer is presenting, because it's always a priority to maximize quality of life after these surgeries by giving the best opportunity for recovery of these muscles and return to bladder control and preserving neurostructures around the prostate or return to sexual function. After prostatectomy, you'll be in hospital for 1 to 2 days. You will have a catheter in place that was put in situ during surgery, and you'll wake up to that already being in place. The nurses will teach you how to look after and manage with the catheter, which will then allow you to manage once you get home, and you'll have this catheter in place for 10 to 14 days, depending on your surgeon's protocol. After the catheter is removed, back with the nurses at the hospital, it is very common for men to experience some sort of urinary incontinence or leak as they move about. It is common in 90% of men after catheter removal from a prostatectomy. And that is why we have started our pelvic health and our pelvic floor physiotherapy prior to the surgery with an assumption that it's going to be something that we're managing and to give you the best opportunity for recovery and the opportunity for quickest return to bladder control. It's normal that you might be managing these bladder control issues for about 4 to 6 months before you feel that you are completely dry, all during the night, all during the day, and with increases in intra-abdominal pressure, such as a cough, a laugh, a sneeze, or a sit to stand. Immediately after the catheter is removed, these movements will be the most bothersome for a urinary leak. And every day there is more healing, and as you start to do your pelvic floor exercises more regularly, you'll find that the leak will lessen and lessen over time. Some men will experience a leak for up to 12 months post-op, and this is generally contributed to by age, the size of the prostate cancer, and other comorbidities that a man might have that might hinder the healing process. The goal of pelvic health physiotherapy, in the advice that we give prior to surgery, is to maximize the amount of healing that is going to occur in the 6-week period post-operatively. Your body's really set up to do this healing, so we want to support it in doing that and maximize the amount of healing and make sure we stay away from anything that might slow down that healing process. If we have a good healing stage for the first 6 weeks, and that's healing of that urethral sphincter where the surgery has occurred, then we have a really good foundation to build more strength on top of as we make our pelvic floor exercises harder. The things that you're going to focus on during the 6-week period. For the first 10 to 14 days, you'll have the catheter in place. And during this time, you don't have to start your pelvic floor exercises. You have done your pelvic floor exercises from your pre-operative physiotherapy appointment through to right just before your surgery, and then after your surgery you're going to have a break from these. There is not going to be any harm in, as you move around, there might be some incidental squeezes and tensing of this muscle. This is not going to harm the surgical area. We just don't see any sense in doing repeated squeezes or contractions around the surgical area when it's in its earliest phase of healing. However, after the catheter is removed, you can start the exercises immediately. And I will give you a program that is a little bit more gentle than the program we've prescribed pre-operatively to start on as soon as the catheter comes out. Things to be mindful of when the catheter is in place is to make sure that you keep the area clean and dry to prevent any sort of infection, which would be a urinary tract infection. You're on prophylactic probiotics to help prevent this, but urinary tract infections can still occur. Keep an eye out for changes in odor of your urine, significant amounts of blood coming down into the catheter bag. The nurses will tell you what's normal, so you'll know what to alert us about if it's outside of the bounds of what we have described is normal. Make sure that the bag is always filling, therefore your bladder is always draining. If not, check for any sort of kinks in the catheter hose and ensure there's always easy drainage. Also keep an eye out for any signs of pain or fever, because sometimes with a urinary tract infection we might not have symptoms through the bladder or as we urinate, but we might have the symptoms throughout the body with high temperature and fever. And that's something to alert the continence nurse or your specialist doctor about. You will need to wear some continence products after the catheter comes out. We usually recommend Tenor or Depends. You'll be given the Tenor products when you're in hospital. These come in the form of guards. There is level 1, level 2, level 3, and then level 4 becomes a pair of pants. Each one of these levels holds a large capacity of fluid. My recommendation is that you don't buy too much of any particular product. You wait to see how you're managing with bladder control after the catheter comes out, and just start with a small amount of what I know will be suitable for the first couple of weeks after surgery. I generally recommend that you get 3 to 4 packs of the level 3 guards and 1 to 2 packs of the pull-up pants for nighttime. This is just something that I've learnt from many of my men over the years of treating during prostatectomy recovery. It is not by any means something that you have to stick to, but it is a good way to start, and then you can change and alter what you're using from there. The pants are good at night because they're not going to shift and move around. The guards are highly absorbent and would be plenty for nighttime because you're going to leak the least at nighttime. The reason for this is the leak is a form of stress urinary incontinence, which means that you are getting the leak when there is increased downward pressure, and during the first weeks after surgery we've got some fatigue and some weakness in the muscles that can't quite counteract the downward pressure that's coming through the bladder. So this comes through with coughing, and laughing, and sit to stand is probably one of the most common complaints that I get at the first post-op appointment. And we don't do these things when we're sleeping. We are lying flat. We produce less urine at nighttime. We are not coughing and sneezing. We are not bending forward and putting our shoes on. Although there will be some small leak at the very beginning, and this will resolve first, and you'll become dry at nighttime before you become dry during the day. The pants, although excessive in their absorbency for nighttime, can help you feel secure so that from day one when the catheter comes out and you're a bit unsure of how your bladder is going to perform during the night, they offer that reassurance where they're not going to move around, they've got adequate absorbency, and you can focus on relaxing and getting a good night's sleep, which is also going to be very important for your recovery. If you get any stinging or burning at the tip of the penis after the catheter has come out, which is very common, because you've had a foreign object at the tip of the penis, and although you create a slack between the end of the penis and the catheter bag that will be strapped to your leg, little bits of movement will cause a bit of friction at the tip of the penis. Pseudo-cream is a really adequate barrier cream which is safe to go at the tip of the penis, and if you put that on first thing in the morning, all your voids and all your leaks during the day won't be as irritating to the tissue that might have been a little bit aggravated by the catheter. I also emphasize that during the first 6 weeks after this surgery and during our healing period, we're really aiming to get a balance between rest and exercise. You want to think about resting twice as much as you normally would during the day and around the house, and moving around about half as much around the house. What I'm going to recommend for your rest period is that you do 2 rest periods during the day. This isn't necessarily to sleep. This is to have a horizontal lie down, whether you are on the couch or in your bed. You can be watching TV, you can read newspaper, you can go on iPads, you can listen to music or audiobooks. You don't necessarily have to sleep. The idea is to take that gravitational weight out of the pelvis, to take the pressure off the surgical area, to promote some healing, to allow any swelling fluid deep in the pelvis to shift and be reabsorbed by the body. Removing that swelling fluid will allow room for some blood to come into the pelvis, and blood will hold healing factors to help with the healing of the surgical area. The gravitational weight's taken off the bladder, and the bladder can fill more easily because you're not going to leak in a lying down position. And the gravitational weight is taken off the pelvic floor so that it gets a rest during this time, and when you get back up, there's a little bit more capacity in the pelvic floor to get through the next chunk of the day. I want you to get up in the morning and move around and have your breakfast, and then mid-morning have a lie down. I want you to get up again with sit-down breaks and then a little bit of movement, and keep a balance between these two, and then have another lie down in the afternoon. For the first week post-operatively, while you have the catheter in still, I want you to do 1 hour rest mid-morning and 1 hour rest in the afternoon. After this first week, you can drop this down to half an hour mid-morning and half an hour afternoon, and I want you to continue this every week until we get to the 6-week mark. You're going to have your post-operative physio session at 3 weeks post-op. So this will be 1 week after the catheter comes out, and halfway through that 6-week period, so I can check in on you, I can reassure you about the leak that you might be experiencing, I can offer you strategies, we will check on your pelvic floor muscle exercises, and I will remind you to do these things that are essential for promoting healing. The balance with some exercise and movement will be walking and walking only. We want you to withdraw from your gym activities, from your cycling. You're not able to swim because you are waiting for the sutures to heal on your stomach from the robotic surgery, or down your lower abdomen from an open surgery, and you'll be able to come back to swimming as soon as those are closed over. We don't want you doing any high intensity activity like running or golf or bowls or tennis. Your whole body movement and exercise is just going to be walking along with your pelvic floor exercises. You're going to do this throughout the whole 6-week period, and then after that we'll return to these activities, and I'll provide you with guidance for returning to those. You're walking initially, and you can walk around with the catheter while it's still in place. This will mostly be around the house and around your yard. After the catheter is removed, I want you to intentionally go out for a walk for a period of time, and then build up during the 6-week period. That period of time will start with about 5-10 minute walking around house, around the yard. After the catheter comes out, I want you to aim for 10 to 20 minutes as we get into the 2-week period, and increase in 10-minute increments each week. So 3 weeks you're aiming for a 30-minute walk, 4 weeks you're aiming for a 40-minute walk, 5 weeks you're aiming for a 50-minute walk, and by 6 weeks you're able to walk for up to 45 to 60 minutes. And you don't have to push it any further than this. It will be after the 6-week period that you can walk and stay upright as long as you want. It is not about the distance that you walk, it is about the time that you are out walking. So you can slow your pace to reduce the leak. You can walk in the morning, you will be stronger with your pelvic floor in the morning, you'll be a bit weaker in the afternoon. Expect more of a leak in the afternoon and know it's because the pelvic floor has just fatigued as the day has gone on. You are not doing any harm to your healing or the surgical area. It is just part of move about at that time of the day. So just to recap on a few of those things, there is no need to do pelvic floor exercises repetitively while you have the catheter in place, and then you will restart your pelvic floor exercises once the catheter is removed. Once the catheter is removed, you can start thinking about doing your pelvic floor exercises with the sets and reps that I've prescribed and performing them 3 times a day. I also want you to think about doing a pelvic floor squeeze on the movements that you start to experience the leak. So if you are getting a leak when you go from sitting on the couch to standing, I want you to try and think about activating your pelvic floor muscles before you stand up in that sitting position and maintain the squeeze as you stand up. I want you to try and think about stifling a cough, activating your pelvic floor muscle exercises, and then performing the cough and then relaxing the pelvic floor. Anything that you do that causes a bit of a leak, try and repeat it with an intentional pelvic floor exercise. If you have the time, try and repeat it 3 times over after you've experienced it, because this not only strengthens the muscle for that particular movement, but it also strengthens the neural connections to remind your muscle to respond when you're doing that particular activity. So if you stand up and get a leak, sit back down, squeeze and stand up, sit back down, squeeze and stand up, and then repeat a 3rd time, squeeze and stand up. We call this leak and repeat. During this first week that you are managing without the catheter and managing potentially some bladder control issues, there's a couple things that you can do to minimize some of those incidental leaks and feel a little bit more in control. I want you to drink as you are thirsty, but I also want you to remember this isn't a time that you have to achieve optimal fluid intake. This isn't a time you have to think about flushing through your bladder and trying to get a full 2 litres through within the day. Generally, we find that trying to drink more, especially if you drink more than 2 litres, it will increase the leak that you experience. So you can draw back a little bit on your fluids. You must make sure that you don't drop below a litre of fluid for the day. And so if you're drinking between 1 and 1.5 litres, this would be 4 to 6 glasses or average cup sizes, then this is optimal. We don't want to drop below 1 litre in the day because this will start to create constipation. The other thing you can do to reduce the load through the lower urinary system is go to the toilet and empty every hour. You might not have a strong urge to do so, but just empty what's there, and you can maintain this so that there isn't too much build-up and too much overflow and too much leak. I will quickly instruct you to start to reverse this habit back to a more normal bladder habit where we hold on for longer than an hour and we build back towards what would be normal, which is a 3-hour hold during the day in between each week. Initially, this is difficult. The longer you hold, the more leaks you will experience. So we start low and slowly increase as you are building up that strength. And this will give you a good sense of control and feel like you are moving along with building muscle strength and achieving recovery. I want you to try and avoid caffeine for the first 3 weeks until you see me for your first post-op physiotherapy appointment. Just remember, caffeine is in coffee, in tea, in green tea, in hot chocolate or anything with cocoa, including your chocolate that you eat, as well as energy drinks and Coke. This isn't harmful for the healing in surgery, it's just going to activate the bladder because caffeine is a stimulant for the walls of the bladder. Switching on the bladder muscles makes the bladder squeeze and want to push the fluid out, which can make you urgent and potentially leak as you're going to the toilet. I will get you to measure the leak that you're experiencing, and you'll bring this in on a chart at the 3-week post-operative appointment, and I can reassure you if you're at a point that is normal for 3 weeks post-op surgery, or it might be better than normal. I will also reassure you if you are controlling things well that returning to drinking caffeine will be absolutely fine. What I do want you to really focus on, and this will extend all the way through to the 6-week period, is avoiding alcohol. Not only is alcohol a diuretic and increases our urine production, which means you will be going to the toilet more frequently, you'll be going to the toilet with a fuller bladder, which we know while we have weakness underneath the bladder through the muscles that control at the base of the bladder, will quite potentially cause more leaking while you're drinking alcohol. I think that it's essential to avoid alcohol for a more important point, and that's that alcohol is pro-inflammatory and this can hinder the healing process, and we want to optimize as best we can in any way possible, accelerating healing and promoting all the good healing that is happening at this time. The lie down periods that I've already discussed are equally as important for this bladder function, because this is your rest and refill time. It is putting a natural stretch through the bladder walls, particularly while you've got the catheter in and the bladder walls aren't necessarily stretching. Most of your urine is just flowing straight down through into the catheter bag. And then when the catheter is removed and you're getting some leaks, bladder isn't necessarily filling all the way up during that period either. But if you're lying down, you're getting this natural fill to the best of your ability, and that will help maintain the health and the function of your bladder walls. I want you to also think about bowels post-operatively. There's no implication on bowels during the surgery in terms of changes in anatomy. There is a hindrance on bowels with the surgical process in terms of going under a general anesthetic and lying down for 3 to 4 hours during your surgery, and fasting before your surgery, which means that your bowels are more empty, and then potentially taking any painkillers that are codeine based. All these things slow your colonic transit, which can often cause constipation, because the slower things move through your bowels, the more water is taken out, and the harder bowel motion can be as it gets to the end of the line. In hospital, this will be managed for you as you'll be provided with a drink that is a gentle stool softener. This is usually something like Movicol or Benefiber. You will have 1 sachet dissolved in water each day, and this will ensure that before you empty your bowels, what's being created in your bowels after surgery is adequately soft, not a diarrhea, but soft for easy emptying. You most likely won't empty your bowels until about day 3 or 4 post-operative, which you might be back home. This is because of the slowing of colonic transit and the fasting that you did before surgery. So you will continue with taking the Movicol generally when you return home, and the nurses will explain how to do this and most likely provide you with some sachets of Movicol to go home with. If your bowels start to become too loose in the days returning home, this can mean that you're returning to your normal bowel frequency, and the Movicol that you're taking is now overcorrecting and causing loose stools. So this is a sign that you can draw back, you can cease the Movicol, and if stools return to your normal, an easy empty, a daily empty, there's no constipation, there's no need to push and strain, and you're not sitting on the toilet for more than 10 minutes, then you don't need to take the Movicol anymore. When I see you at 3 weeks post-operative, I'll check in and ask you if your bowels are moving well, and check to see if you have changed your Movicol intake. If you're getting loose stools, I'll remind you that you can cease taking the Movicol.